Brittney Slater, thank you so much for joining me today to talk about your presentation that you are going to be delivering at the State of Therapy conference at Clark University on September 26th. You're going to be discussing digital dialogue, helping couples integrate AI with relational growth. How do you do that?
Yes. So I have been finding that many of my clients over the past couple of weeks and months have been telling me that they're using AI to help them dissect their discussions with their partner, help them gain new insights and things like that. So I just thought, what better time to delve into this topic? And I think one of the ways you want to look at that is, how you can use AI as a therapeutic tool, right? I think a lot of our clients are already using it, and I think if there's lots of ways that you can do that responsibly, and I think there's also some ways that AI can be a little bit harmful. So I thought that this might be an interesting topic to delve into those two sides of things and figure out best practices for how to move forward.
Yeah, so do you have an example of how you might use it with couples that you see?
Yes. So one of the best examples that I have been using AI for is to help couples gain insight into how their partner might be feeling and thinking, which I think is a very beneficial tool in couples therapy in general. And the reason that this started coming about was I was having a lot of people that were telling me that they were typing their arguments into Chat GPT to say, what does it spit out essentially? Does it tell me I'm right or does it say the other person's right? Which we all know is not the goal of couples therapy. So one of the things that I started using AI for is I said, hey, how about you try prompting it from your partner's point of view, right? See, if your partner was typing this in, what would AI be telling them? Do you agree with this? Do you disagree with this? So I actually think that's one of the helpful ways that we can use AI in the practice is to say, really expanding your view beyond just yourself. And I think AI can be a helpful way to challenge that in a similar way that an individual therapist might challenge that.
Sort of takes the emotion out of it when you're dealing with AI. Is that right?
Yes, yes, exactly, exactly.
Mm.
hmm And I think, this will be I will be covering this in the seminar, but this will a lot of also times be based off of the prompts that you give AI, right? I'll say like that's kind of your bread and butter is all about how you challenge AI to challenge you. Again, I see that very similar to therapy, right? We have some therapists, where our clients give us feedback of, I would just like to have a supportive ear, someone that I can just kind of talk to and sort of reflect. And I have other clients that really want to be challenged and really want to be pushed. So I think, again, one of the ways that is helpful to integrate AI is to have clients self-reflect on, what are they looking to get out of their therapeutic journey? Are they looking for emotional support? Are they looking to be challenged? Are they looking to grow? Ideally, it's all those things, but I think it's also getting a realistic baseline for where the client is ready in their therapeutic journey.
There's a lot of concern about AI and therapy, or people using AI for therapy, and that it will ultimately be a replacement for therapy, that people will tend to do that, put us out of business kind of thing. But, also just that, a lot of fear around it and the kind of feedback that people might be getting and what kind of harm that might do.
Yes. Yes.
So what do you advise around that?
Yes, so I think those are legitimate concerns. Is one side of me. The other side of me is anything new can be scary. I think anytime new technology has come out, there's always been a sense of fear, the idea of how is this going to disrupt what we've come to know. So I think those are legitimate fears, but I actually think that is why this discussion is so important, especially for therapists right now because AI is being used and it's not going away. You know what I mean? I think that's something I personally see getting a little missed in some circles where people are trying to dissuade their clients away from it. And for me, I'm seeing the accessibility of it. You meet with a therapist once a week for an hour, usually max, maybe two if you're in, higher need. AI, the internet is something people have access to 24/7, right? So it makes sense that people are turning to this. So for me, I would rather see people learn how to use this responsibly rather than just try to encourage our clients to avoid it altogether. I know I've said this before, but being in the sex therapy background, my personal belief is that abstinence only does not work. It is not a good way to inform clients. It is not a good way to educate people. And I feel very similar around AI. Rather than try to get people to avoid this, I would rather help coach therapists and clients on how can we use this responsibly, right? Using it not as a replacement for therapy because there are limitations to AI. And I think it's really important for clients and therapists to understand what those limitations are so that they can use it effectively.